You're watching Medical News Network. I'm Mike Wittgenstein. In studio today, we have one of Arizona's top cosmetic dentists, Dr. Paul Gebhardt, and we're discussing veneers. Before we went to the break, you started to describe to me the difference between a crown and a veneer, but I'm not sure I got the whole answer. What is the difference?
Well, a crown fits around the entire tooth. It covers it up from the top of the gums to the end of the tooth on all surfaces. Goes around it. Everybody pretty much
And a veneer doesn't go all the way around the tooth?
No, a veneer just goes on the front of the tooth. We shave down the tooth just a little bit to make room for the veneer, and it gets bonded right in front of the tooth. Just kind of
like a fingernail.
Yeah, kind of like an acrylic fingernail.
And they're strong?
Oh, they're very strong. They're really fragile when you're holding them in your hand. As soon as they get bonded to the tooth, they are very, very strong.
And you can't, well, I honestly can't, done right, you can't tell the, can you straighten teeth? Like teeth that are front, back, maybe a little turn side, can you straighten them?
Oh yeah, definitely. You know, if a tooth is sticking out, we reduce it a little bit more. If a tooth is sitting back, we don't have to reduce it at all. We can just bond the veneer right to the front of the natural tooth. You know, it's great. It's like instant braces.
So what would be a bad veneer job?
A bad veneer job is something that you can tell. Patient walks into the room or into a Christmas party and they smile and you're like, oh my goodness, what?
They got like the big, because I've seen that, the big,
they look like chiclets.
Horse or chiclet?
Yeah.
Little bitty chickens, or those big giant horse teeth?
Yeah.
Is that in the hands of the lab, the dentist, your mouth?
A little bit of both. You know, if the dentist is in control of the lab, he has to do the work. He's ultimately responsible. If he's not using a good lab, he's not going to get good results. So he's got to make sure that he's using a lab that's going to give him the results that he wants. You know, there's so many different types of veneers and so many different.
How much of it is artistry, and how much of it is actual technique when you do veneers?
I would say it's probably about 70% artistry and 30% technique. You know, our technique is most dentists have a fairly good technique as far as being able to shave a tooth down. Shaving it down in the right directions, the right amount of tooth structure being removed, that's where the artistry really takes place.
If somebody goes to get there and they get a little bit, say the dentist removes a little bit too much tooth, or can you fix most problems?
Oh, definitely. If there's too much tooth.
If I have veneers and I'm not happy with them, can you have them redone, or once they're in, you're done?
No, once they're in, they're going to last for 20 years. If you want to have them redone because you don't like the way they look, or you don't think that the dentist that you were seeing had done an adequate job, we can just shave the veneer right back off as if it was your tooth structure. Take you right back down to where the previous dentist had removed it, fix any problems that were made with the preparation technique, and start the case over from scratch at that point.
Okay, what about, say, older people? Maybe get some bad teeth, haven't been able to chew properly in a while. Can you fix those kind of problems with veneers? Oh,
definitely. There's a lot you can do for worn dentition or worn teeth. A lot of times it gets a little bit more comprehensive of treatment. We have to build up the back teeth a little bit to open your bite a little bit. But once we open your bite and we have some space to work with in the front, then we can put either veneers or all porcelain crowns. But most likely veneers would work just fine. Restore the teeth so that you actually have a nice smile line where it's supposed to be, rather than too high up underneath your lip. You know, a lot of people you see, they'll walk into a room and they won't smile, they'll cover up their mouth, or when they do smile, you really don't see a whole lot of teeth. It's because their front teeth are worn down, and we can restore all that with veneers.
Where you get that like little yellow line across the tooth?
Yeah, that's very common in the elderly population. The teeth wear over time. The incisal edge, or the edge of the tooth, wears down. There's no more enamel on the tooth. So you start to see that dark yellow line across the top of the teeth. That is basically the inner surface of the tooth, the dentin inside the tooth.
What about, is there a minimum number you have to do? Like if I had one tooth, do you have to do 10, or can you do 1?
It depends on what you're really looking for. If maybe you've had a root canal done on one of your front teeth and the tooth is dark.
I've seen that, where like just one tooth. Is that what it is, a root canal, where they've done that?
Usually a tooth that darkens is from the nerve has died on the tooth. Whether it's had a root canal or not, maybe the tooth was bumped when you were 10 years old riding your bike. You know, that tooth can darken up over time. One single veneer can fix that. If you're looking for a real smile makeover and you want to have all these other problems that maybe, the length of the teeth, the width of the teeth, spacing in between the teeth, discoloration.
You said you can close that gap in the front?
Yeah, that's very easy to fix. The spacing between the teeth, all that can be restored. I usually like to have somebody that really wants a nice smile makeover to have a minimum of 8 veneers done. That way we can round the corner of the mouth so that when you smile, you get that nice big white broad smile.
But you can use veneers to repair single teeth if that's what it
definitely,
takes?
Yeah.
Now, do you use veneers in conjunction with anything else? Do you? Can you?
A lot of times patients come in, they may be missing a front tooth, they may be missing something on the side, they have some crowns that have already been done, but they want to have a whole smile makeover. Then you'll intersperse a couple of veneers, a crown, a bridge, all encompassing the smile makeover.
What about pain? Do they hurt?
No.
I mean, can't we?
Everything in dentistry has a little bit of, maybe a little discomfort here and there, but we do everything in our ability to reduce the amount of discomfort that you may have. But veneers don't hurt at all.
Does your office practice sedation dentistry, pain-free dentistry?
Yeah, we do. We offer sedation dentistry, nitrous oxide gas. We also do some oral conscious sedation where we give you some medication orally, put you into la-la land basically.
And then you get them done. Wake up and they're done.
You're in the chair for an hour.
Are they hard
or so.
to learn to use once you have them? Does it change your speech? I mean, can it change your speech? I've seen people whose speech changes after they get the veneers put in.
Well, generally for a little bit of time afterwards, you have to get used to them. When I had my veneers done, I smiled and I said, that didn't look like me. But a week or so later, I got used to the way they looked, and I saw such an improvement. Your lip
Give you a little more self-confidence?
A lot. I had always been ridiculed when I was a kid. Oh, he's got buck teeth and things like that. And I had the orthodontics done, and that straightened them out, but I still just wasn't happy with the way they looked. They were brown, and they were misshapen. They were just too straight and just looked funny. So when I had the ability to get them veneers done, it made a huge impact on my life. I could smile. I was a dentist. I wanted to be able to portray dental health, and I couldn't do that with the way that my smile looked before.
Now, if you have, you address the gums when you do the veneers? Mm-hmm. You clean if there's any disease, and do you think it's physically better for your health if your mouth's in good shape?
Oh my goodness, the correlation between heart attack and stroke and periodontal or gum disease is been shown repeatedly over the last 2 years. They're saying that actually gum disease is a better causative factor of heart attack or stroke than high cholesterol levels.
Now, if you have, if I have some bad teeth and I have a little bit of gum disease, if I take the time, I put the veneers in and clean it up, will that help?
Oh, definitely. If you have any decay in your teeth, we can fix that decay while we're doing the veneers. You end up with a really nice smooth surface right at the gum line. What do your gums like? They like smooth. They don't like rough, jagged edges. They don't want ledges. They want nice, smooth edges.
We have to take another break.
Okay.
I hate to cut you off, and I do want to see your pictures. So when we come back, we're going to look at your before and afters, and we're going to a few more particulars about exactly what veneers are. You're watching Medical News Network. I'm Mike Wittgenstein. We'll be right back.